Hi, good morning and good afternoon. Greetings from Pakistan. I'm Faisal Sultan. I'm the Special Advisor to the Prime Minister on Health. And in the next few minutes, I will try to tell you about hepatitis in Pakistan, in particular hepatitis C, and the coexistence and impact of COVID-19 in the present time. When we look back to 2008 and draw a trajectory, an extrapolation of where we might be in the future, it does look a little bit concerning. Back in 2008, the HCV infection prevalence was around 4.9%. And over the years, it has actually come up, and right here in the present time, in 2020, we think it is around 6.9%. If the present trend continues, we would reach a prevalence of 9.3% in the future in 2030. And back in 2008, even we had the second highest number of hepatitis C cases in the world after China. So there is no question that in Pakistan, hepatitis is a public health emergency. And we are committed to eliminate hepatitis by 2030. Now, as part and parcel of this program, we have had a Prime Minister's program which was put together for the elimination of hepatitis C infection. We have a fundamental goal and aim of eliminating hepatitis C by 2030. And this 10-year program has two phases. Phase one from 2020 to 2025, and the second phase from 25 onwards to 2030. So the main objective of phase one is to screen 50% of the eligible population using rapid tests. And this is for population over the age of 12. The second objective within phase one is to run an HCV PCR on all those that test positive on a rapid test. And then, of course, to treat all those that come out with a positive PCR for hepatitis C infection. There are additional or complementary objectives within phase one, and one of them is to actually strengthen the supply side, the health system, with a focus on supply chain management and building human resource across the system. At the same time, to actually generate some demand of this, because without this, the program would not be a success, and this will require an effective and careful communication strategy. And then, of course, we do need to strengthen the information system, the monitoring abilities, and to evaluate the program progress. And then within phase two, these activities would need to be replicated and to fill in any gaps that remain. So the global target, the overall target by 2030 is to make sure that 90% of all hepatitis C patients have been diagnosed, 90% of those eligible have been treated, and 90% of those treated are cured. So a 90-90-90 plan. The Prime Minister's program target, of course, in phase one, as I mentioned, July 20 to 25 is to screen 50% of the population, which means a rapid test screening process for 69 million people. And we estimate that that would mean a PCR confirmation in about 5 million people, and then over 4 million people would require treatment. In the second phase, which will go on from 2025 onwards, you'd need another 102 million people to be screened. This is an ambitious program, but nevertheless, the nature of the problem is such that it does require ambition and boldness. So the intention and discussions of the program were to launch the program in early 2020. However, right in February, we had the first case of COVID reported in February. And of course, then maximum enforcement of the non-pharmaceutical intervention started by mid-March, and with a number of social distancing measures, all of which, of course, contributed to a stoppage or halt of this program. A lot of attention and money got diverted to the COVID-19 response, to ramp up testing, surveillance, the healthcare capacity, risk communication, creation of biosafety labs and PCR machines. So really the entire focus in terms of manpower, systems and money got immediately and urgently shifted. So tens of thousands of healthcare staff were trained on infection prevention and control and disposal of infectious materials through the WeCare program. And as I mentioned, will mention in a bit, this also will pivot into an opportunity. So because of this, the program, including the hepatitis-related activities, were not prioritized, delaying the Prime Minister's Hep C program. But where are the opportunities? Both COVID-19 and hepatitis C are viral infections, which are confirmed using a nucleic acid method. And during COVID-19, the biosafety labs that were created, PCR machines that were added at a secondary and tertiary level into the health system will actually play a significant role in helping us to pursue the hepatitis program. So on top of these PCR machines that were placed in, 400 gene expert machines are already available in the district headquarters hospitals. And these, of course, can also be used to deploy nucleic acid testing for hepatitis C, as they are now being done, as they're now being deployed to some extent for COVID. So there is an opportunity here. I think the urgent buildup of the health system that came into force during COVID will actually help in ensuring that the hepatitis program is also adequately powered. In addition to the simple deployment of machine and manpower, the other thing that is crucial in a program like this, of course, is coordination and cooperation. And so during COVID-19, what we saw was really an unprecedented level of coordination through the National Corona Operations Center. And really, it will serve as a blueprint for coming health challenges. And I feel that this learning that has been done ought not to be wasted and ought to be immediately deployed for other programs, not the least of which is hepatitis C, but then other things like polio and our expanded program on immunization and other infectious diseases. The other benefit out of this is that the mapping of existing resources, especially diagnostic, PCR, etc., has happened. So not only that they are there, we know where they are, and so their use would be made easier in the present circumstances. We also learned integration of the data. The data flows were fixed, and a backwards and outwards reporting to the provincial and district levels. So a two-way communication between the provinces and the national system was ensured for COVID, and I think it'll go a long way in helping us bridge any gaps that exist for hepatitis. Of course, training and capacity building of the health workforce and on infection prevention and control is yet another facet that I think will go a long way, because a lot of hospitals really learned a more formal and more stringent way of infection control than what they were practicing earlier on. And on top, of course, as I mentioned earlier, on the demand side of things, the mass risk communication is important. And again, for COVID, we were able to deploy this using conventional and modern methods, all the way from cell phone messages, voice, call tone, dial tone messages, and social media, and so on. So I think that this COVID crisis, while it put a pause onto things, has also provided an opportunity and shown us a path as to how we can utilize this to control and conquer other diseases. So the challenges, of course, have been that multitasking in the health system of a major crisis is sometimes difficult. I think even in advanced developed countries, this is a challenge. But for a developing country, I think this is certainly an issue. And of course, the other problem that has existed until now and may even exist in the future, if God forbid we have additional waves, is that the strict enforcement of NPIs and closures of outpatient services, of course, impact on other diseases, their care and prevention, which of course includes hepatitis. This also has led to issues where the global and domestic supply chain disruption has become and could potentially be another area where we would need to overcome a challenge. And so now we have almost a year's delay in the delay of the Prime Minister's program. But nevertheless, we feel that we currently have strong political commitment. There is complete buy-in from the provinces and within the national system, and also within the public and decision makers, that healthcare is a priority. And this commitment is required to make sure that we take care of the public, and especially in terms of prevention and control of epidemics and infectious diseases. And of course, hepatitis C is certainly an important infectious disease to sort out. Of course, as I mentioned earlier, a concerted effort to strengthen health systems and infrastructure and health services is there. In addition, use of logistic and supply chain management and management information systems with interfaces across the provinces down to the district and implementation level are also crucial, and many of these systems are now in place. We do need to, of course, build capacity of the health workforce on infection prevention and control, and to make sure that also has cross-cutting effects on other infections like hepatitis B, C, tuberculosis, and others. And of course, risk communication to the general public about infection prevention and control does need to continue across all levels to make sure that the public is with us, because without that, you cannot really have success. So I'll stop here, and I'm very grateful to all of you for your patient listening. Thank you very much.